talk a little bit about maintenance of your implants. So with silicone, if you ever have a rupture, you might not know it because you don't absorb the silicone, and therefore you can be walking around with a silicone rupture and not know it's all still contained in the scar tissue capsule that forms around the implant. There are times when you might feel like there's some discomfort. There are times where you might actually feel like it just feels looser or different, or you could have additional scar tissue because of the rupture, so the whole breast could feel different, but it is possible to not know. With a saline, if you have a rupture, the water is going to leak out, be absorbed, and it's going to feel and potentially look like it is smaller. A very significant rupture, it'll just go completely flat. So one of the things to consider is the maintenance. Now in terms of surveillance, this sort of announces itself. This often does not. So for the silicone implants, they usually recommend getting regular imaging, which is MRI, or now somewhat becoming normalized ultrasound. So there's a lot of maintenance involved in both, but there's a little bit more surveillance on the one that doesn't necessarily announce if it has an issue.